welcome back to the Wellness Paradox podcast. I'm so grateful that you've joined us on this journey towards greater human flourishing. As always, I'm your host, Michael Stack, an exercise physiologist by training and a health entrepreneur and a health educator by trade. And I'm fascinated by a phenomena that I call the wellness paradox. That is the gap between what we know as a health sciences community and what we actually implement in the real world to make a real difference with real people. This podcast is all about closing off those gaps by disseminating the latest, most evidence-based, and most engaging information in the health sciences. And to do that today, I'm thrilled to be joined by a true visionary in the fields of lifestyle medicine, public health, and nutrition, Dr. David Katz. Now, I'm sure that name sounds familiar to many of our listeners due to Dr. Katz's prominence in many academic and medical circles, as well as his many publications, books, and national media interviews. While the depth and the breadth of Dr. Katz's background is quite extensive, and our conversation could have gone in many different directions, this podcast will focus on a very poignant topic: the pandemic of chronic disease that has existed for decades before we ever heard of the COVID-19 pandemic. While COVID-19 has received much attention this past year and a half, and rightfully so, the insidious pandemic of chronic and non-communicable diseases such as obesity, diabetes, and cardiovascular disease has received comparatively little attention, even though its annualized mortality rate nationally exceeds that of COVID-19. Let me say that a different way. The pandemic of chronic diseases is like having a COVID-19 pandemic every year, year after year, for literally decades. And this pandemic shows no signs of abating anytime soon. The chronic disease pandemic, as Dr. Katz so eloquently puts it in our conversation, takes years from our life and life from our years, while at the same time wreaking havoc on our medical systems, the productive capacity of our workforce, and our economy. Does that kind of pandemic sound familiar to any of you? Now, Dr. Katz's perspective is not fatalistic. As you'll hear, he passionately presents many solutions to this quite complex problem, which is critically important because there's no vaccine coming for this long-standing chronic disease pandemic that we faced for decades. More information on this podcast and Dr. Katz can be found on our show notes page by going to wellnessparadoxpod.com/episode 8. I truly hope you enjoy this engaging conversation with Dr. David Katz. And welcome back to the Wellness Paradox podcast. Today we're joined by Dr. David Katz. Dr. Katz, thank you so much for joining us.
Great to be with you, Michael. Thanks for having me.
Now, I want to get right in this discussion because there is a lot to talk about around a very interesting and compelling topic. But before we dive into it, I think it's important for people to understand a little bit about your background, just to have some context for our discussion today. So why don't you give our audience a little bit of an idea of what your background is like?
All right. So the nutshell version, I went to medical school after college, majored in French in college, by the way. I finished most of my pre-med requirements in high school. I figured I'd be doing science for the rest of my life, wanted to know something else. So I had a fantastic education in the humanities at Dartmouth, and it served me well ever since, Michael. I really think in many ways, art and the humanities and the liberal arts, great lens to better clarify science, both for oneself and for others, because, things like metaphor, analogy, great ways to explain. A picture's worth 1,000 words, and education in those areas really provided the word pictures that I've relied on my whole career. Went to medical school, 4 years later was done. I was at Albert Einstein in the Bronx, and went on to residency in internal medicine. That's 3 years. And then, it's during that time when you're in the hospital for over 100 hours a week, pretty much being tortured relentlessly by everybody higher up the food chain than you. But, mostly what you're doing is learning how to prevent people from dying on your watch. And we were reasonably good at that. But I also had the impression all the way back then, this was in the early 1990s, that we were learning how to be all the king's horses and all the king's men. Because, we were pretty good at forestalling death, not always successful, but pretty good at that. But we were never restoring complete vitality, right? You can't unscramble an egg. So I found myself, both challenged and privileged to be learning how to take care of people in acute need, but also very frustrated that there was so much terrible pathology we could never completely reverse that never needed to happen in the first place. So I decided I need more. I need to be involved in preventing all of this unnecessary mayhem. So I went on to a second residency in preventive medicine, public health at Yale. And the rest, as they say, is history. I completed that in 1993. Within short order of my graduation from that program, a paper came out in the Journal of the American Medical Association entitled Actual Causes of Death in the United States that really altered the trajectory of my career. I mean, I think that's unusual, that one element. I knew I was going to be working in diet-related issues, nutrition, but I did think I might spend my career in clinical research asking, erudite questions no one had thought to ask before, probing for the answers, the usual thing that researchers do. This paper basically told us that if people ate optimally, were physically active, and didn't smoke, 80% of all chronic disease and premature death would go away. And I said, aha moment. I've got to devote my career to turning what we already know into what we do. It's just, it's folly to leave that neglected and go chasing after the 20% of chronic disease we don't know how to prevent yet. We know how to prevent 8 out of 10 cases. Let's do that. So my career's been about that ever since.
Yeah, awesome. And, if I'm not mistaken, you were very instrumental in the American College of Lifestyle Medicine. I mean, you've really taken this from something that inflection point in your career early on, and you've really helped build the field to a great extent.
Well, that's very kind of you to say. The College of Lifestyle Medicine in the United States, which was the first, was established a decade before I got involved. John Kelly is credited with being the originator, but there were a number of others involved then. And it was very small and fairly insular. And I was invited to toss my hat in the ring and run for president at a time when the college was at a critical inflection point. It was either going to stay very small and possibly fade away, or expand its representation of the evidence-based expanse of lifestyle as medicine, and invite people with real stature from nutrition science and epidemiology and community interventions. So I was privileged really to serve as president. I had an extended tenure just because of the way things worked out. At the time, the college made that pivot. It sort of navigated a hairpin turn, brought in an incredibly talented executive director, Susan Benegas, who continues to run the show there. And we started to take off. And, again, I may have had something to do with it, or maybe I was just along for the ride, but we grew massively on my watch. And then since then, the college has grown by over an order of magnitude. And it's the fastest growing medical college in the United States. And there are sister organizations now sprouting like mushrooms all around the world. And they're all growing very fast. So it's a movement. And yeah, again, I wasn't there at the very beginning, but I'm pleased to have caught the wave eventually and maybe contributed something.
Well, yeah, you're very humble. You contributed definitely more than something, and you've advanced that to now your own organization, the True Health Initiative. Let's talk a little bit about that.
Okay. Well, first of all, thanks for the kind words. And in at least that one instance, you're absolutely right. So I was president of the American College of Lifestyle Medicine after having been president-elect, and then became immediate past president. And I tend to be very analytical and very honest. So, for example, I look at the 30-year span of my career, and I get awards and recognition and accolades, but the reality is I'm a failure. I mean, anybody who's trying to prevent chronic disease or reverse trends in obesity so far is a failure. Anybody trying to leverage lifestyle to combat climate change, preserve the Amazon and biodiversity is a failure. We're losing the war. So I'm very honest about these things. And, I think that's healthy. And I don't say a failure in a way where I'm beating up on myself. It's just an honest appraisal. We're not winning the war. We have to do more. We have to find new methods. We have to find new allies. So similarly, I was president of college, and it was a privilege. But I thought, so what in the grand scheme of things? There was a president before me. There'll be a president after me. And what's really going to change? And what I recognized was that there was an opportunity to create a legacy that could have a lasting impact. And it seemed to me the single greatest deficit was in public understanding of how much scientific consensus there really is about the critical elements of a healthy lifestyle, including diet. And I thought, I've gone to conferences all around the world with a very diverse group of experts. Sometimes I'm with vegan experts, sometimes I'm with paleo experts, just a wide array of diverse. I'm sorry about the puppy noise that'll occasionally infiltrate this. There's nothing to be done about it. And essentially, you spend enough time at conferences, you wind up having meals together. And it was striking for a long period of time that, when we all lined up to get our food, the vegans who really were genuinely expert in eating well had a plate of, mixed greens and beans or lentils or, as their protein source. And, the paleo experts had the same plate of greens, but, where my vegan colleagues had beans, they had wild salmon or game or, in relatively small portions. But what was fascinating to me was those two plates looked more like one another than either looked anything like the typical glow in the dark, Frankenfood American diet. And the public has no idea. The public, basically hears paleo and vegan experts calling one another names all the time and says, no two nutrition experts agree about anything. I'll just keep eating whatever I want. So I really felt that's a critical issue, and I compared it to getting to the moon back in the 1960s. There were three critical elements to getting to the moon. We needed to want to go. We needed native human ingenuity to get the engineering task done. And we needed to know where to find the damn thing. I mean, if we had disagreement, the moon's over there, no, it's over there. No, that's not really the moon. That's the moon. No, we got to go this way. You can't get there from here if you can't agree where there is. And so with regard to diet and lifestyle, I thought, we can't even get the public to understand that there's massive agreement about where there is. If we could start with that, then we could begin the worthy effort of figuring out, okay, now how exactly do we get there from here? So the True Health Initiative brought together what looked to be dueling experts across multiple domains, the experts who favor the Mediterranean diet, the experts who think exercise is more important than diet, the experts who think sleep is more important than either, everybody, but rallied them around, these are common principles we all agree are critically important. Food should be, as Michael Pollan described it, real, not too much, mostly plants. The formula for lifestyle medicine involves feet. I say it this way: feet, forks, fingers, sleep, stress, love. So feet, physical activity; forks, dietary pattern; fingers, don't bring tobacco products to your mouth; get enough sleep; don't get too much stress; and strong social connections. We can all agree that if we get that formula right, 80% of all chronic disease and premature death in the modern world could go away. And the public deserves to know that whatever our disagreements about details, we agree about all of that. So we've been waging that campaign ever since. And, since my time as president of ACLM, when I established the True Health Initiative, we've grown massively. And our council of directors is about 500 strong from 46 countries. And it's really a who's who in modern public health. It's an incredible roster. Names everybody knows, like Sanjay Gupta, but several former surgeons general of the United States and chairs of departments and deans of schools and CEOs of healthcare institutions. And so, I'm really proud to be in their company and say there is sense about healthy living. There is a massive amount of science about healthy living, and there truly is global expert consensus. And if we could just rally around science, sense, and global expert consensus as true north, then we could get down to business and figure out how to get there from here. And human ingenuity could do it. But we've got to know where there is. And that's the primary mission of the THI.
Yeah, and I think that's great. There is so much tribalism that seems to exist in health and medicine and nutrition. But you're absolutely right. We agree on 85% of the things that are there. And the most compelling conversations at least amongst all of us in the health sciences, are about the 15% we don't agree on.
It's what we want to talk about, and it's understandable, really, Michael. Let's say, 80, 85%, 90% of what matters is settled. Well, then, to be an expert means more than just knowing what has been settled. Being an expert means working on the part that isn't. So if you're working on that residual 10, 15, 20% your whole career, and you go this way, and I go that way, I'm going to talk about this, you're going to talk about that, and it's going to sound like we disagree. But, essentially, those are the branches of a Y. There's the very long stem. We agree, we agree, we agree, we agree, we agree, we agree, and we disagree. And all we'll talk about when there's a microphone in front of us is the disagreement, and that distorts the public's understanding of where the science really is. So, I'm sympathetic to why it happens, but it's absolutely crucial that we have a remedy, particularly now, where, as you say, we're so tribal. I mean, the diet wars are just ridiculous. I mean, even within a small domain. So it makes me wince to think about some of the vegan tribal wars I've seen, different branches of veganism, and, whether it's okay to include oils, olive oil in your diet, yes or no. I mean, some of us think it's perfectly fine. I mean, others just, skull and crossbones, and everybody gets really riled up, and they start calling one another names and ad hominem attacks. I mean, it's crazy. And this is a faction that's, pretty much to the rest of the world, it all looks like one group. But this happens with everything, right? I mean, to much of the world, you sort of, from altitude, I've been to the Middle East many times, spent a fair amount of time in Israel. Yeah, most of the rest of the world would see Israelis and Palestinians think, aren't you guys very close cousins? I mean, to the rest of the world, looks like you're living very similar lifestyles, and how come all the fighting? It's amazing how we can convince ourselves that there's massive dissent and disagreement when, frankly, we're so much more alike than different. So it is a big problem. THI is a big solution. We've got a long way to go, to create the signal that can be audible above the noise. But it's never been more important. And that noise, it contaminates everything. Contaminated our pandemic response. It contaminates our response to climate change. It contaminates the dialogue about vaccines. There's so much misinformation circulating through social media. And sadly, the research on this is pretty robust, but false information travels better than true, because true information is bounded by what we actually know. There are rules to follow if you're telling the truth. If you're lying, there are no rules. So you just make it as titillating as possible, and people eat it up.
Yeah, I feel like we could dive into a very deep philosophical discussion on all of this, but we actually do have something that's very germane to talk about. And you actually hit on it in some of the things you just said. You mentioned that a unified front is more important now than ever. And you mentioned the pandemic. And when I first talked to you about this podcast, I said, David, I could talk to you about 1,000 different things, apparently even French now, which I didn't realize that. But I really wanted to focus on something that was critical at this juncture in public health. And we discussed the idea of this pandemic, or pandemics, plural, before the COVID-19 pandemic. And let's talk about these pandemics of ill health, which you have written so eloquently about, have kill on an annualized basis the more than the number of people we've seen die in this country from COVID, yet it seems to get swept under the rug, or maybe we've become tone deaf to it. Unpack this a little bit for us. Well,
again, Michael, thanks for the kind words. And yeah, it really is a glaring incongruity. And, we react to the acute, we react to the new, the shiny, the exotic. But quite frankly, we had a pandemic before the pandemic. We had pandemic obesity. We had pandemic type 2 diabetes. We had pandemic heart disease. If we aggregate all that, we had a pandemic of chronic or non-communicable diseases. Literally pandemic, because essentially they're spreading through populations around the world. They're taking years from lives. They're taking life from years. The toll attributed just to bad diet in the United States, just bad diet, something we have complete control over, right? We manufacture this food, is over 500,000 premature deaths every year. There was an op-ed in the New York Times by Dariush Mozaffarian, Dean of Nutrition at Tufts, and Dan Glickman, former Secretary of Agriculture of the United States, entitled, "Our Food is Killing Too Many of Us." If you haven't seen that, I commend it to you. It was August 26, 2019. Our food is killing too many of us. And in that op-ed, what's nice about it is Dariush Mozaffarian, of course, is a very serious scientist. So they cite the primary studies that make the case that in the US and frankly, modern countries all around the world, most of this comes from something called the Global Burden of Disease Study, poor diet quality. And we're not talking about where people are starving. That's a problem in its own right. We're talking about food is available. It's just, willfully adulterated junk where food ought to be, sold at high profit. Well, that's predatory profiteering if ever we saw it. People are dying as a result of poor quality diet. And the mediators of that are obesity, diabetes, heart disease, cancer, stroke, dementia. I mean, all of the adversities of modern epidemiology are fueled by junk where food ought to be. 500,000 deaths a year. Now, when we crossed the 500,000 mortality toll for COVID, we had a national moment of silence, right? We reflected, we mourned, we grieved together, and rightly so. That many people die prematurely from poor diet, which we have total control over every year. And there's no reckoning, there's no mourning, there's no grieving, there's no acknowledgement. It's just business as usual. And listen, if I know this statistic, everybody can know the statistics. It was in the New York Times, for crying out loud. I mean, this hides in plain sight. Where is the outrage? I mean, parents, hello, your children are being exploited to fatten the coffers of big food at the expense of years in their lives, life in their years. Where is the outrage? It's really quite incredible. So, at almost any level, you examine the landscape of modern epidemiology, you say massive, massive burdens of human misery we're totally capable of preventing. So then it begs the question, why does this hide in plain sight? Why don't we do something about it? And of course, I've spent years ranting about this and writing some really big books. So this 750-page monster, which is really good for holding a door in a heavy wind, Truth About Food. The truth about food is 7 words long, and they're not even my words, they're Michael Pollan's words. Eat food, not too much, mostly plants. That's pretty much it. So, this is a 200,000 word book. So the other 199,993 words are all about the lies. Why does this hide in plain sight? Well, there's massive profit in pseudo confusion about diet and lifestyle. There's massive profit in chronic disease. We talk a lot about the costs of chronic disease. Well, sure, somebody's paying the bill. But big pharma is reaping enormous profits. Big medicine is reaping enormous profits. I mean, a lot of businesses run on chronic disease. It's a huge part of the American economy. So there are a lot of vested interests that don't want to fix this problem. And that's different from COVID. The other thing that's different from COVID, I think, Michael, and we're going to have to deal with this if we want to be more effective at optimizing the human condition, is the timeline. The human nervous system is hardwired for flight or fight reactions that play out in seconds to minutes. There's nothing that happens over days or weeks or months or years, let alone decades or lifetimes, that triggers a fight or flight response. Fight or flight response are, you're suddenly startled. And that's because, back in the days on the savannah, the things that were likely to kill us came at us really fast, red in tooth and claw, as the expression goes. So our perception of threat requires an immediacy. COVID delivered that. The fear was, I'm going to catch this tomorrow and it's going to kill me next week. When we talk to people about, heart disease, yeah, okay, maybe eventually, yeah, you're right, I should really change my ways, but, not today. And diabetes and obesity and stroke and dementia, it's all stuff that happens in slow motion. Now, of course, the effect over a lifetime, if you lose a decade or more from your life, you lose many decades in terms of quality of life, it's a massive toll. And when you talk to people at that end of the spectrum who are already dealing with the burden, they say, if only, if only I could go back and fix it. Well, you can't. We've got to fix it in anticipation, and people are blasé. So it's the timeline, and then it's, I think, the fact that familiarity breeds, if not contempt, and maybe even that, certainly complacency. It's not new. It's not, it's crept up year by year, decade by decade. We've been soaking in it forever, so it feels okay. And corporate America tells us all the time it's okay, right? Just keep eating hamburgers, just keep drinking Coca-Cola, don't worry about it. We're doing the same with climate change, by the way. I was watching, or trying to watch, the Olympic trials the other night, which I couldn't watch because they were postponed. because of extreme heat in Eugene, Oregon, heat they've absolutely never seen before since they started recording weather in this country. And so you cut from, watching what should be Olympic trials postponed because of devastating heat, obviously due to climate change, obviously caused by us, and immediately go to commercials for, hamburgers and Coca-Cola and big cars, business as usual. That's a stunner too, because during the pandemic, very quickly, all of corporate America responded. All the commercials were reshot. People were wearing masks. We were encouraging one another, we'll get through this. We're in it together. Where is that for climate change? And why isn't it there? Because that is by far the biggest existential threat we face. We are ruining the planet. That is the one issue. We're not, there isn't going to be an end to that. Pandemics end. If the planet ends, it's over for our species. And, we're complacent about that too. So timeline, familiarity, maybe sometimes the problem just feels too big to solve. And so, we're apathetic because we just don't want to deal with it. I'm not sure, but it's a confluence of issues. Some are predatory, again, massive profit in the status quo. Some are due to the nature of human response systems, but we've got to overcome all of that or our goose is cooked.
Yeah, there's so much in that, but I think what you said about the natural human fight or flight response, and I said this earlier in the pandemic, and it's heartening to hear you make the same observation that most of our health concerns are never this proximal. They've never been as proximal as what they are now. Knowing that we're hardwired like that, and knowing that people tend to have a short memory, because right now we're sitting here, we're on the backside of COVID, fingers crossed, variants notwithstanding. And the question becomes, are we just going to forget about all this in 6 months or 12 months? How do we take the positive momentum that is existing around leading healthy lifestyles, and how do we translate that into some longer term changes? And to add to that, it seems like this is just not a matter of personal responsibility and willpower. It seems like we just can't put this on the individual. We have to go a step further. So I guess I'd like you to riff on that for a second.
Yeah. So two issues there. First, I'd love to say that I'm sanguine about our long-term memory, and we're not going to forget. This was too big a deal, and we'll address the root causes, and we'll carefully assess zoonotic infections. We'll look at the interactions of humans and wild animals more carefully. We'll do better surveillance. We will invest in public health so our responses are better. We'll develop the next pandemic response before we're in the middle of the next pandemic, because our response to this was a calamity. An absolute case study in how not to manage a pandemic. It really was. And frankly, there's been altogether too little attention to the prior pandemic, which, and I don't think we said this explicitly, Michael, and we should, is a massive, massive contributor to the toll of SARS-CoV-2. Mm-hmm. There was a paper in the Journal of the American Heart Association just a couple months ago, look at basically doing modeling to estimate how much of the total hospitalizations for COVID in the US and how much of the total mortality due to COVID in the US would have been avoided if people didn't have prior cardiometabolic disease, basically heart disease or diabetes. And the answer was about 60%. Colleagues and I did a paper where we estimated it was minimally 40%, but this paper says at least 60%. So, whether it's 40, 50, 60, there's nothing anywhere on the horizon that would have empowered us, to slash the mortality of COVID that much. And that's how these two pandemics came together. So much of the acute burden of COVID was in fact attributable to the chronic burden of prior disease. So these two things are not just, important, but separate. They're important, and ineluctably bridged. Mm-hmm. And so, a huge part of our pandemic response and preparation for whatever comes next is let's get healthy. I started ranting about this very early in the pandemic. There's never been a better time for a national Let's Get Healthy campaign. And then when the Biden administration put together their task force, I reached out to friends and colleagues who were on it and said, guys, you've got this covered in many ways, but, I think there ought to be a very vigorous health promotion component, and you know where to find me. And I haven't heard from them, and there really hasn't been any discussion of that. So I'm not sure, leaving aside the issue of memory, I'm not sure that ever got the attention it deserved. I mean, you're talking about it and thinking about it. I'm talking about it and thinking about it, but who's listening to us? It's a little hard to tell. Bill Maher is talking about it and thinking about it. It was at least three of us. But, it's getting very, very little attention. And that's tragic. I was privileged to give opening remarks at the American College of Lifestyle Medicine annual meeting this past year. And I spoke briefly about lifestyle medicine during the pandemic. And the title of my remarks was The Acute Case for Chronic Health. And it was all about this incredible overlap between cardiometabolic ill health and the threat of COVID. Now, I've had COVID. I think you know that. Very mild case. I'm 58 years old. Theoretically, I'd be someone who could have a very serious case. But I use lifestyle as my medicine. I'm in perfect health. I think I probably have the cardiometabolic status of most people half my age or less. Very mild case. I do, by the way, have some long COVID symptoms I'm still dealing with these 5 months later. So it hasn't been a cakewalk, but, there was never any threat that I would need the hospital or, and just because of cardiometabolic health, my experience was what I expected it to be. And it's, it's just really tragic that we saw this perfect storm where communities of socioeconomic and demographic disadvantage had higher burdens of prior chronic disease, diabetes, obesity, and therefore were harder hit by COVID. And oh, by the way, they're also the people who couldn't stay home from work because they're frontline workers who were exposed more, really perfect storm. So we've got big public health issues in the mix here too. Disparities we need to address, inequities we need to address, racial and otherwise. There's a lot of work to be done. All of that would be part of preparation. If we want to be forewarned and forearmed against the next pandemic, all of that needs to happen. I don't know that we've really learned any lessons. I think we were so polarized. There was an awful lot of arguing, very little indication of unanimity and consensus during the pandemic. Now there is relief to be getting back to normal, or anxiety. You see both. I mean, some people are just, yay, it's back to the world. And other people are, I'm not so sure, but, I really wish you were still wearing a mask because you're making me anxious. I don't yet hear much enlightened reflection on what went wrong. How could we do better? I'm hopeful, but I'm not entirely confident. And it's worse than just having a bad memory. We've yet to make that an issue in the first place. Once we do, we will probably forget about it pretty quickly because that's what we do. Our memories are short. Our attention spans notoriously shorter. But we have to at least make it a priority issue in the first place. I haven't heard nearly enough about that. I don't know how you feel, but that it's rarefied dialogue to be saying this was largely, whether this virus escaped from the lab in Wuhan or whether it involved bats and pangolins or, one way or another, a virus that was capable of pandemic transmission entered the human population. It has happened before. It will happen again. How do we know about it early? What are the right mechanisms? And my colleagues who do animal husbandry and study wildlife, they're advocating for the importance of a One Health approach. We're literally all in this together, all denizens of this planet, right? The bats, the pangolins, the orangutans, the people, the dolphin, it's one world. And so we really do need to monitor better our interactions with the rest of the biosphere, because that's where plagues get started. But we really are not considering the massive differentials in the morbidity, mortality experience with COVID due to chronic diseases, and hearing world leaders say, for a whole host of reasons, we need major investment in health promotion. The days of junk where food ought to be need to end. The days, where people cannot figure out how to shoehorn any physical activity into their daily routine need to end. Right? I mean, we could put an end to that if there were the will. We could devise the way if we had the collective will. I'm not hearing nearly enough dialogue on those topics.
Yeah, it's so interesting that you say that, and it's so accurate. And I can't help but think the dialogue that we're talking about isn't sexy necessarily. It's eat healthier, it's move more, it's all those things you talked about earlier. And unfortunately, it just seems like the media wants to talk about the silver bullet, the latest, vaccine or treatment or whatever it might be. And you and I both well know there's no vaccine coming for the pandemic of obesity. It's not on the horizon.
It's true. And so two responses to that. One, you're right, in a sense, it's not sexy. And so we need to do a better job of making it so. And if not sexy, at least compelling. And I've been trying to do that for years. I actually wrote a paper years ago, Michael, in the American Journal of Health Promotion, Facing the Facelessness of Public Health. Because, essentially the value proposition we're talking about here is we could eliminate 80% of chronic disease and premature death. But, you say that, epidemiologically, that would be transformational. It would be the most stunning advance in the history of public health, by far. 80% less premature death from all causes. Wow, mind blown. But still, when you say it, it's completely bland and uninspiring because it's just a statistic. It's, okay, fine, big deal. I started many years ago making that assertion from the podium and then asking my audience, so have I brought a tear to any eye in the room? Any tears? A lump in the throat I'll settle for, So I make a joke out of it and then say, okay, well, let me show you what the problem is here. How many of you love somebody who's been affected by heart disease? Please raise your hand and keep it in the air. How many of you love somebody who's been affected by cancer? Please raise your hand and keep it in the air. How many of you love somebody who's had a stroke? How many of you love someone who was diagnosed with diabetes? How many of you love someone who has dementia? Now look around the auditorium. Everybody has their hand in the air. In other words, this very short list of the chronic plagues of modern epidemiology have invaded all of our families. Now, think about that. Conjure to your mind's eye the face of one of those people you love. Remember the day you got that terrible news. And by the way, it may have ended badly. It may have ended well. Maybe they came home from the hospital. Maybe they never did. Sometimes they do, sometimes they don't. But picture that face you love and think about how that story played out. And now imagine a world where 8 times in 10, when I ask this question, your hand doesn't go up because that stuff never happened. That's what an 80% reduction in all chronic disease and premature death would feel like. It's not remote. It's not statistically anonymous. There is no public. There's you and me and the people we love and everybody else, and we would feel it. We need to do a better job, I think, of conveying that. So is that sexy? I don't know, but it does bring tears to eyes and it does bring shivers to spines. And, I think people get that. So I think there is that. I also think, we don't really convey in our culture the value proposition of health. One of the other things I've argued for many years is we would go a long way toward the prize if we simply treated health a bit more like wealth. People aren't shopping around every day for a new sexy solution for wealth. That's the stuff of sitcoms, right? In the old days, it was the honeymooners. Ralph Cramden was always in on some get rich quick scheme. It never worked. He was always stuck, driving the bus at the end of the episode. So, serious people are serious about their money. They don't listen to nincompoops. They don't change what they do with their money every day based on rogue theories. They're not waiting to hear that there's a whole different way they should invest next week when they watch the Today Show or Good Morning America. This week you should invest this way. No, take all your money, take it out, put it into this week. It doesn't happen. You're serious, you're cautious, you separate sense from nonsense, you listen to people who actually know what they're talking about, you don't do anything terribly radical, it's going to take time. You put some away for tomorrow, you enjoy some of it today, you think about your children, you want to bequeath it to them, you want to pay it forward, all of that. Well, just replace wealth with health. Invest in it today, protect it for tomorrow, share it with the people you love, pay it forward, bequeath it to your children, only listen to serious people who know what they're talking about. Do not make radical changes week by week because of some crazy thing you hear on the morning shows. It works beautifully, right? So, there are all sorts of ways we could have the cultural revolution we need and infuse our approach to health with a bit more sense.
Yeah, and it's interesting because it strikes me in hearing you say all that, and you use the words value proposition, which is typically a term we use in business quite frequently. And a lot of this seems to boil down to our messaging strategy as a public health community. And I think we saw during COVID the inability to actually effectuate a good, consistent public health message. And so I'm curious, what should that messaging start with?
Sorry about the interruption. As I said, dealing with a rambunctious puppy who would not be denied.
Yeah, for those of you that are not watching this, David got up and did a little bit of physical activity to get his feet moving.
That's right. If you're just getting the audio, this is all going to be a little weird. But yeah, for everybody else, Sorry about that. I think we have to ask the question, how much will messaging accomplish? I tend to be a form follows function kind of guy. And so, I'd almost think about engineering and reverse engineering. So, we essentially need to operationally define the scope of the problem. And just as one example of that, and let's use obesity, but it could be type 2 diabetes or heart disease or any of these slings and arrows of outrageous epidemiologic misfortune, which do not need to happen at least 80% of the time. So one of the analogies I've used over the years is drowning. There was basically a case made initially by the AMA some years ago that we should label obesity a disease so it would be given more respect medically, and there'd be less bias associated with it, and doctors would take it more seriously. I'm for all of that. It deserves respect. We should stop blaming the victim. And by the way, you asked about personal responsibility before. We should definitely loop back. It's an important topic. Mm-hmm. But we should stop blaming the victim. We ought to be more compassionate. Doctors certainly should take it seriously. They should know how to address it and all of that. But I have a problem with labeling obesity a disease because the way we treat disease is more drugs, more surgery. And there's nothing wrong with the human body when it comes to obesity. The human body is supposed to take a surplus of calories today and put it in storage for tomorrow. That's the defense against a rainy day. The problem is the environment. The rainy day never comes. We're constantly surrounded by a surplus of calories. So throughout most of human history, calories were relatively scarce and hard to get, and physical activity was unavoidable. It didn't require gym membership or specialized footwear. It was called survival, and everybody just did it every day. We've devised a modern world where physical activity is scarce and hard to get, and calories are unavoidable. And not just calories, hyperpalatable, willfully engineered to be addictive calories in constant, ubiquitous, abundant supply. We have no native defenses against caloric excess or the lure of the couch, never having needed them before, so we succumb. But that's not the human body behaving badly. That's an environment that's at odds with native human adaptations. What's a good analogy for that? Well, drowning. We don't blame the victims of drowning. We also don't try to come up with drugs and surgery to fix drowning. We recognize that the human body doesn't have gills. We're just not adapted to stay underwater for too long. So what's the remedy? Well, we put fences around pools. We admonish one another to be very vigilant about young children. We have lifeguards at the beaches. If the water is unsafe, we put up signs about rip tides, and we teach our kids to swim. And we may do other things too, but that's a pretty robust set of defenses. And one more thing, every now and then, despite all that focus on prevention, somebody does drown, and then we resuscitate them. And there's no stigma, and the bills get paid, and there's no question about the medical legitimacy. So, basically I said, no, I don't want to call this a disease and invite big pharma to come up with more drugs or more bariatric surgery where better use of feet and forks ought to be. I want to call this drowning type B. Drowning type A is in water. Drowning type B is in junk food and labor-saving technology. And the result of drowning type A is your lungs fill with water and you asphyxiate. The result of drowning type B is obesity, type 2 diabetes, coronary disease, et cetera, et cetera. Both are bad. Both should mostly be addressed with preventive efforts. And then if you flip it around and ask, well, if we were to treat drowning the way we treat obesity, what would we be doing? We wouldn't put lifeguards at the beaches. We'd say, you're on your own, personal responsibility. We would not put fences around pools. We'd say, good luck. We would not admonish one another to be careful about what's happening with young children, because after all, we routinely feed them junk food. And we would put up misleading signs at the beach that say, when there is a riptide and sharks, come on in, the water's fine. Because that's what we do with advertising. We deceive people about the quality of food all the time. It would be unconscionable. If we were willfully leading people into situations that cause them to drown en masse, wouldn't there be outrage? Wouldn't it be a national scandal? We're doing exactly that with food. So I like that analogy. It then leads, I think, to this notion of, what should the message be? And my answering that with another question, how much will messaging accomplish? It's part of the solution. But I think a start to the messaging should be, there is massive global expert consensus about the fundamentals of healthy living. And if we embrace them, they can add years to lives and life to years. You will feel it. You can share it with the people you love. I think getting people excited, not about the negatives. There's enough doom and gloom to talk about these days. The positive. More years in your life, more life in your years. And maybe even reminding people, you may think about health like this, and what I'm doing is wagging my finger. I'm the doctor wagging his finger, right? It's the admonishing finger. No, 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 don't think about health like that. Health is not something you should do because a doctor says so. Healthy people have more fun. It's just that simple. I mean, health is a currency you can spend on living the life you want to live, whatever that is. You like to travel, you'll travel more. You like to hike, you'll hike further. You like, whatever it is you like to do, there'll be more of you to do it if you have health and vitality. Health is for a better quality of life. It's not the ultimate prize, health. It's the currency you can spend, and the only currency you can spend to buy the ultimate prize. More years in life, more life in years. I think people need to understand that. So I would start there. I think people could use a positive message. And then I would move into a wide array of component problems and a wide array of component solutions. And then just to quickly loop back to your question about personal responsibility, it's been a huge issue for me my entire career, written extensively about that. And for folks who are interested, I wrote something I called the Personal Responsibility for Health Chronicles. Back in the day, I was writing for the Huffington Post. And it's a 6-part series of essays. So if you just Google my name, Personal Responsibility for Health Chronicles, you'll find probably the 6th one. And then you can work back from there because each of them hyperlinks to the previous ones. And so, multi-part essay on the fact that some things we have to do for ourselves. And so, yes, there's a role for personal responsibility. Absolutely. What I do at the end of the day with my feet and my fork is up to me. But the choices each of us makes are subordinate to the choices all of us have. And you can't put people in a situation where, for example, the food supply is willfully engineered to be addictive by scientists who get paid a bonus when they can get food to reach the bliss point. If you don't know this story, read Michael Moss, New York Times Magazine cover story, The Extraordinary Science of Addictive Junk Food. New York Times Magazine cover story, Michael Moss. Just Google Moss addictive, you'll pull it right up. Definitely worth reading. And it's a story that's been told many times before, but Michael tells it brilliantly. He's the author, by the way, of Salt, Sugar, Fat, and Hooked. Well, again, you don't have good choices when, huge companies are paying scientists bonuses to design food you can't stop eating until your arm gets tired from lifting it to your mouth. I mean, when Lay's potato chips ran that ad, bet you can't eat just one. It was a threat. And it wasn't just about Lay's potato chips. It was about, 95% of the entire food supply. So absolutely, there's a place for personal responsibility, but there's also a place for responsible policy, responsible corporate behavior. Sometimes the best remedies for protecting the human body reside with the body politic. There's a balance to be struck.
Yeah, and going back to your drowning analogy, we do a lot to modify the environment to ensure that we limit the likelihood that that is going to happen. And to a great extent, particularly with the most socioeconomically disadvantaged in our population, that going back to COVID, we know that disproportionately affected them. Looking at any of the chronic disease states, that disproportionately affects them. It really is the people on the lower end of the socioeconomic continuum that have to contend with this the most.
Absolutely. Yeah, as I said, perfect storm. Colleagues and I did a paper on the epidemiology of risk factors for bad COVID outcomes pretty early in the pandemic, published in the Journal of Emerging Infectious Disease. And it was actually picked up by the New York Times. Nadia Popovich and a colleague did a major piece on that perfect storm issue, that essentially there were communities that had socioeconomic disadvantage, effects of racial and social inequities, injustice, high percentage of people with blue collar jobs who can't work remotely. They needed hands-on physical labor, massive burden of cardiometabolic disease, and then of course huge COVID toll. It all happened in the same place. So as I say, when we think about how do we reverse engineer this, some issues are much bigger than any one health crisis. How do we effectively address disparities? And then you start talking about enhancing educational systems, making sure people have an opportunity to self-actualize. And, next thing you know, you're having an extensive conversation about public policy that may not feel like public health, but ultimately all good public policy is public health policy, because, when you optimize conditions for humans to thrive, it is a public health intervention.
Yeah, absolutely. And you truly hope this is an inflection point, but the challenge that you have laid out here very passionately and very succinctly is great. And it takes a lot of us to build a groundswell of support to actually make this happen. For the people that are listening now, and we get a mix of people that listen to this podcast. There are some people that are in the general lay public that are health enthusiasts. We have people in the various health sciences. What would you say to them? What as foot soldiers do they need to be doing right now to try to make this a reality?
I asked the question rhetorically before and got a little worked up because, I've raised 5 children to adulthood with my wife. And, so these questions about, predatory profiteering at the expense of children, where's the outrage? I feel it when I start talking about it. I would say that's the question, right? I mean, where is the outrage? Where's the outrage about apathy regarding the climate? I started writing about that. Again, I do not want to cut from the Olympic trials delayed by weather. I mean, it's never happened in history. I mean, it's completely crazy. It's just too hot in, the Pacific Northwest to run a foot race. Hey, everybody needs one of these gas guzzling SUVs and, eat your hamburgers and eat your highly processed food and business as usual. It's all good. Where is the outrage? I mean, if enough of us are disgusted when we see that cultural abdication, and we convey that in our social networks, and I don't necessarily mean online. The people we interact with and love and care about, and we say, this is just wrong. Well, ultimately, it's interesting. When the genomic age was ushered in, we were all very excited about the potential to modify human destiny by manipulating our genes. As it turns out, DNA is not destiny, and for a lifestyle medicine specialist like me, dinner is. But we're far too inattentive to the fact that we don't have complete control over our genes. But we do have complete control over culture. Culture is an incredibly powerful agent of change, and it's a medium of our own devising. We are in charge. So I think it's up to us who are enlightened, people who listen to a podcast about wellness, to say so much of what we're doing is just so fundamentally wrong. And we must overcome the political tendency toward myopia. These short timelines don't work anymore. We cannot just keep kicking the can down the road. Again, the climate crisis is here. We're not waiting for it. But I've begun to wonder, and I suspect, many others have too, and I sometimes am lying awake at night wondering in anxiety about this. All those science fiction scenarios, a dystopian future. Okay, once you're on the far side of the dystopian future, you're just there, and then you're just trying to survive and, dodging Terminators. What about the people who weren't quite in the intact world and weren't yet in the obviously dystopian world, but were sure as hell on their way? When did they know? Mm-hmm. Right? And did they do anything to try and stop that inertia? Because I think that's us. And it scares the hell out of me. So I think we need a bit of collective outrage. I think we need to be honest. I think we need to express ourselves. My clinical colleagues, I've said to physician colleagues many times, from partners and really all health professionals, if you don't advocate fiercely and frequently for the health of the planet, I don't think you qualify as a health professional in 2021, because there are no healthy people on an uninhabitable planet. And we are blindly headed in that direction. So, if you're wondering, is that in my purview? Hell yeah, it's in your purview. And by the way, there's a great new book from Howard Frumkin, Sam Myers at Harvard, Planetary Health. And Sam is a physician. They're both physicians, actually. And it really is about the clinical, the medical impact of what we're doing to the planet. And there are more and more materials being developed, one from the Gables Institution in Florida, just out, on what health professionals can do to counsel patients about, more sustainable, healthy lifestyle. So I think for the health professionals in the mix here, we need to be in the vanguard of a cultural revolution. The apathy must end. There really is cause for outrage. And so some of what we do, we can do directly with our patients. much of what we do, we just have to be enlightened citizens. I think we have to be politically engaged. I think we have to support organizations. I think we have to function with communal strength. I think we have to speak out loudly and proudly about causes that matter to us. This massive burden of cardiometabolic disease is unnecessary. It too is a pandemic. It too requires a crisis response. Predatory profiteering that mortgages the future health of children to fatten corporate coffers, unacceptable. Not just every health professional, but every loving parent and grandparent. It's time for change. Apathy in the face of an environmental calamity that threatens the future of our species, let alone our quality of life, is unacceptable. It is an existential threat to our profession. We are about health. We are saying no. We are saying it with a unified voice. So, I think there's a lot we can do. We just have to decide that we've got a common set of priorities, and it's time to stand our ground.
Well, I don't know about everyone else listening, but if that doesn't get people fired up, I don't know what will. Very well said, David. I can keep talking to you for hours on end, but out of respect for your time and our listeners' time, I want to bring this to a close. You mentioned a lot of resources during this, and we're going to link up to many of them on the show notes page. So thank you for that. But for our listeners that want to learn more about you, the True Health Initiative, where are the best places for them to go?
Well, thank you, Michael. It's been a pleasure. And I agree. We could talk probably forever, and just as well for those who don't want to listen to a 20-hour podcast that we wrap this one up, but let's do a part 2 sometime. Yeah. I have a website that's kind of a hub to all things I do. There, you can find my books there and my columns and public speaking and links to both my business and the True Health Initiative. That's davidkatzmd.com. There's also a link to my wife's free recipe site, quiznicity.com. Fantastic recipes. Katz Family Greatest Hits. Help yourselves. She's the best. But all of that accessible at davidkatzmd.com. My nonprofit, we talked about the True Health Initiative, truehealthinitiative.org. And then we didn't talk about my day job. I left academia in Yale after a better part of 30 years, and I saw patients for 30 years. I now run a business dedicated to making diet the vital sign it deserves to be. We've invented a whole new approach to dietary assessment that can do that. You can learn more about that at dietid.com.
Yeah, we didn't talk about that, but that is absolutely a phenomenal tool. So we'll link up to all that. And I want to bring this to the close with one final question. And there's a part of me that thinks in some way, shape, or form, you may have already answered it, but I want to leave our listeners with something succinct from you. And this question is about the title of our podcast. There's a gap between what we know as a health sciences community and what we actually implement in the real world to make a real difference with real people. If you could advise those that are listening to do one thing to close off that gap, what would that one thing be?
Well, if it's in their own personal lives and if it's about their own personal health, we have a set of choices, right? Feet, forks, fingers, sleep, stress, and love. The one thing I would advise everybody to do is, it's kind of like from City Slickers, for those who know the Billy Crystal movie, where the crusty trail boss says there's just one thing, but he doesn't tell you what the one thing is. That's kind of my advice. It's Curly's advice. Find the one thing. And what I mean by that is, maybe the thing that is most weighing you down is a toxic relationship. And you don't want to talk about food until you address that, or you hate your job, or you have chronic pain and can't sleep and you're exhausted all the time. Or, I don't know what the one thing is. If you were my patient, we'd figure it out together. But identify the one thing that if you could fix that, you would say, what relief. And then figure out a way to address it with help, on your own, whatever needs to happen there. And then take the oomph that you get out of fixing that first thing and invest it in fixing the next and fixing the next. Because all of us deserve to climb that spiral stair up to the ramparts of vitality. Again, more years in life, more life in years, healthy people have more fun. But the formula, the sequence of those steps is not a one size fits all, Michael. So, the formula is universal. The way you're talking about translating what we know into what we do, I think that's highly personal. So I would say, if you want one universal message, it is appreciate how much vitality could be worth to you and the people you love. And then figure out what is that one thing you want to start with, and then start. Because all great journeys begin with a single first step, and the sky's the limit once you get going.
Dr. David Katz, thank you so much for your time. I truly hope you enjoyed that conversation with Dr. Katz as much as I did. If you found it informative, insightful, and maybe even a little bit inspiring, please share with your friends and colleagues. Those shares really do make a difference for us. For any information on Dr. Katz or anything he shared, please go to the show notes page for this episode at wellnessparadoxpod.com/episode 8. Be on the lookout for next week's episode when it drops on Wednesday. And don't forget to subscribe through your favorite podcast platform. Until we chat again, please be well.